we'll go ahead and get started because I think as we move along, hopefully, I believe somebody had mentioned, provided that we're interesting enough, they'll stick around for a little while. Not naming names, but till, so we will endeavor to go ahead and get started and be as interesting as possible. When we sort of looked at this whole idea of doing a safety workshop, the first thing is there is so much going on that, quite frankly, we would have had a couple of hours worth of material. So what we did is we sort of broke down the agenda, if you will, down to the first half or the first 20 minutes or so are things that PPACG has focused on here within the last year. And the big caveat to that is, about 3/4 of the way down, there's promoting high school safety. We actually, PPACG, do not have one of those programs, but we are supportive of those programs. And because I know that that was a big issue, we added that to the agenda, and we brought in Christy Tennant, and we have Trish LaKenta for to sort of talk about that. Then, if you notice, sort of the open discussion at the end is where we really want to sort of hit where you guys, anything that you want to talk about. We did our best to sort of bring folks in. So we've got Jason Nelson from CDOT here. We've got Emma from El Paso County Health. We've got Todd from Colorado Springs. And again, Christy is still going to be here. And then we also have Ted Richard, our consultant. One of the things I do want to sort of talk about is, right as we're ending up, we'll hit the cross causation study. And that's, if you notice, that's got the sort of the biggest time block. Councilmember Donaldson, you had mentioned, hey, so what happened to the numbers in 2020? And we will actually kind of touch on that, where there seemed to be a shift in behavior in 2020. And we noticed that in the numbers as well. And that's why, and when I say we, it was really Jason O'Brien, who sort of was the guy that sort of spearheaded this and said, hey, we need to dig deeper into this. So we've actually been doing a cross causation study here for the last few months. And so Jason and Ted are going to touch on that. So with that, we'll sort of, with that understanding of the agenda, again, chatting about things that we've been doing here at PPACG, we'll go ahead and get started. So we've, back in, I think it started in 2020, maybe in 2019. We started in January coming to you and doing safety briefings. So the very first one, Jason O'Brien came. Sorry, this is going to be really difficult for me. Well, Jason's here. And Jason started coming to the board and talking about the trends. And I didn't realize this was going to be one of those timed ones. But he comes to you and gives you all of the sort of the national numbers. And then he breaks down the Colorado numbers. And again, I don't know if Commissioner Elsner is on the line, but there was specific requests to always sort of have us open up the what's going on in Park and Teller counties. So we've always tried to make sure that our safety briefings touch on all 3 counties within the PPACG region. So in addition, so again, we talk about national, state of Colorado, as well as the counties. And this is just sort of the data. I don't think we've had such a backlog of things to sort of get on the agenda for you guys here at the board. I don't think we've actually done our sort of annual safety briefing. Although I think we did something at CAC back in well, maybe that was, anyway, since we've got so many things going on, we haven't done that yet. But this is, again, the opportunity that if that is something you want to see, we can bring it again later this year. If the cross causation study doesn't sort of hit what the information you're looking to get. So that's one thing that we do as PPACG staff for that. Additionally, and for those of you scoring at home and marking things off on your agenda, I'm now on agenda item number 2. We have our federal planning dollars that come into PPACG, and then again, since 2019, we have set aside $50,000 of PPACG funds of our federal dollars. Again, that's not your local dues; it's our federal monies that is matched with your dollars. So you're not paying the whole brunt, to do some sort of safety campaign. So for those of you who have been on the board a while, you might remember a few years back we had the Drive Sober. It was a social media campaign. It was during the election, so we could not obviously buy any sort of TV time, right? TV time was just out the roof. So we had a social media ads that we did that, and they were sort of the starts as a car and turns into a tin can crashing. There was a motorcycle that was a beer bottle and ended up crashing, and I forget what the third one was, but it was a very effective sort of one. And come on up, Jason. What was it, like 50,000 clicks or something, or is it more?
Yeah, 50,000 clicks and about 5 million views. So equivalent to everyone in the 3-county region seeing it multiple times.
Right. And so those of you who always have your Facebook open, you probably took more of that than just your 3, but you know what I mean. So again, from a safety point of view, we as a region, and again, we can't do anything unless you guys have said it's okay for us to do it, have stepped up and been running these media campaigns for the last few years. As a result of the pandemic, we moved Drive Smart Colorado under the PPACG umbrella. And I think I have a sort of the overall, hopefully you've all seen this before, and if not, this will not be the last time you see this, but there, the 4 E's of traffic safety, enforcement. And again, you all as elected officials do a great job of having your local police and sheriff deputies going out and enforcing traffic laws and regulations. There's the engineering side of it. And again, you as elected officials do a great job of making sure that we have the staff in place to build a reliable transportation network. And again, we got Jason Nelson and Todd, who, if you have any questions about what sort of engineering things that they're doing to build in safety, those guys are thinking safety in everything that they're doing. EMS is in emergency management. And then there's the education side of it. Why, look, Drive Smart Colorado lives there in education. So, and again, this is where it's been, we've seen that there was a gap or a void, and we really couldn't have Drive Smart Colorado just go away, especially since after the pandemic, all of our numbers for fatalities and serious injuries were going up in the wrong direction at a time when you think that maybe people were driving less and they should be going down. So when Drive Smart Colorado was going to sort of shutter and go dark, we made the offer to move them under PPACG here. And when I say we, again, it was you as the board passed the resolution to accept Drive Smart Colorado under there. And also we redid the bylaws. So we have 3 of the PPACG board members sit on the Drive Smart Colorado board. Help me out. Is it Glant? And who else is on our board? On the board? Was it? Oh, Roland. That's right. Because you took over and I think the last one's Commissioner Elsner, correct? Yep. So we do have folks on the PPACG board, also on the Drive Smart board. This is just a little bit of that chronology that I think I've already given to you. Again, because of the COVID, moving from all online sorts of activities, their grants were written to be in person doing stuff. So they could not fulfill their grant requirements. And they had to go dark. But again, thanks to the actions of the board of directors of PPACG, Drive Smart was moved under our umbrella. In 2022, we completed the Community Traffic Safety Education Review, or what we called the gap analysis, where we sort of looked what all the different folks were doing for transportation safety in the region, and sort of looked at where we had overlap and where we had some gaps. Actually, Danelle will talk about that in just a little bit in more detail. And then here in 2023, we got the CDOT Office of Transportation Safety grant to hire a safety champion, which is Trish. Say hi, Trish. This is where you say hi, Trish. Never mind. But again, what we're finding is it's good to have someone out there sort of getting folks together and having conversations on how we can all band together. One thing that's sort of under here, and Christy Tennant, I want to say, hey, Christy, thanks. See, she gets it. Is that we have actually, I'm going to go off script. Can you come up for a second, Christy? We have the Drive Smart Safety Coalition, which for a while was sort of renamed the Southern Colorado Safety Coalition. Can you kind of go through some of the folks that are members of that? Was it the second Tuesday in this room? We have the Drive Smart Coalition meet. We have the DUI task force meet, and the kids.
Safe Kids Colorado Springs.
So who all shows up to those meetings and that we're facilitating that conversation?
Oh, man. So to those meetings, we have presence from healthcare. We have UC Health. I work for Common Spirit, which is Centura Children's Hospital, Colorado. We have representation from the El Paso County Sheriff's Office and Colorado Springs Police Department. We do have participation from other department agencies as well. We have close ties with fire. We have Divide Fire, really great representative that takes all the minutes. So we have various people from different organizations with different perspectives and pieces that they can offer.
Oh, yeah, thanks. And so again, it's that conversation. And again, Christy is our chair of that, and she'll come back up later when we get into the school programs. Regional crash data. Well. So another thing that we've done is, again, what's the old saying? If you care about something, measure it. That's not it. I don't know. If you want something free, let it go. I don't know. Anyway, but there's this, but basically there is crash data that we're receiving, and it was not cleaned up. And so Will and our team sort of geocoded it, so the right side of the road, and we know more about where accidents are actually happening by year. And the next slide, I think, is your data dashboard. I'll let you click through. Okay, you have one up there of the data dashboard.
All right. Hi, William Mast with PPACG, the GIS admin and modeling lead here. Yes, we do publish our crash data. We have crash data going back all the way to like 2009 online. We make it available for the public and anybody else to use. We typically do it in a rolling 5-year increment. So as we get it from the state, we, as John said, we geocode it or linear reference it. It's basically taking all the records themselves and putting some spatial attributes to them so they can be mapped. And we do that for the 3-county COG region. And then we add some additional attributes to the data just to help make it a little bit easier to read, such as whether or not it's a fatal crash, if it's serious injury, and that's just going through the notes to identify if somebody was transported or not by ambulance, to determine if it was serious, if it was minor injury or property damage only. So we've got some scripts that we run to help clean up the data, make it a little bit easier to read for some of the big questions that people ask regarding the crashes. We have just finished the 2022 crash data, so that will be uploaded shortly. And then, so instead of 2017 to 2021, it will be 2018 to 2022. And again, because that's that rolling 5-year period, we typically get the data for the previous year, usually around September from the state, and then we start working on geocoding it, and it's usually about now we can go ahead and publish it. We do have a dashboard just to make the map a little easier to read. Again, you could use the map, but with the dashboard, it automatically pulls up some statistics. So we have just over 11,000 crashes that occurred within the 3-county region for 2022. So that'll be added to this as the 2017 data drops off. But with the dashboard, just again, at a quick glance, makes it easy to identify not only where those crashes occurred, but gives you an idea of how many of them were fatal or serious injury or minor injury or property damage only. And we can break it out by not only by the year, but by the time of day, the day of the week, other trends like that. And then we have on the dashboard some filter buttons, again, just to answer common questions. How many occurred within my city? How many occurred within my county? How many of them involved a pedestrian or a bicyclist? So just clicking on those allows the data to be filtered very, very quickly and easily.
Thanks, Will. And again, when you're writing grants for these sorts of things, right? So if Manitou Springs is like, hey, yeah, we're going to go after a safety grant, this dashboard is something where you can go in, isolate your geography, isolate the type of accidents, and then generate that data that could help you write those grants. So that's a good tool. Another activity here is the education review that I had mentioned earlier.
Hello again. As John mentioned, we kind of realized that there was an increase in traffic crashes, serious injury crashes, fatalities in the region. We knew, that there's a lot of really passionate people out there, a lot of organizations that are doing really good work. But we felt like there might be a lack of, we suspected that there were some gaps in this coverage. So this community traffic safety education review, which we generally call in-house the gap analysis because it's much shorter, was intended to try to identify those gaps and identify which organizations are doing what things. So if we hop down to the next, thank you. So this is just kind of the project overview here. We started that in September of 2022. And it was accepted by the board of directors in October of 2023. And it did include an outreach section. We included a safety matrix with that final deliverable that gives all of the organizations and what kind of elements that they're touching, as well as a final report. That first section of stakeholder outreach, we reached out to 70 or over 70 entities and individuals. You can see that we got no response from a majority of those, which in itself says something about the state of the region and traffic safety education. We also attended some board meetings for Drive Smart Colorado, the Safety Traffic or the Traffic Safety Coalition, and Safe Kids as well. And the idea behind that outreach was really to get an idea of what's going on, what are some of the issues, what are the challenges. So this slide just gives some highlights of those barriers. We heard multiple times that resources are scarce, staffs are spread thin. There are folks who are doing things in a bubble. There's lack of communication. There's lack of collaboration. And so building on those issues and challenges and recognizing those, there were also some recommendations that were put together by our consultant team. A big theme in those recommendations was reinvigorating Drive Smart, bringing together those organizations, bringing together those people that are doing things and figuring out how to make them work more cohesively, figuring out how to get people working together, and just building on the momentum that is there in the region and has been there in the region. So that brings us at PPACG to, obviously we couldn't address all of these recommendations. Some of these are outside of our wheelhouse. Some are outside of Drive Smart's wheelhouse. But what we could really focus on was putting together a grant to try to get someone to help fix some of these gaps. And that's where our regional safety champion comes in. So what we did was we put together a grant application for the Office of Transportation Safety's Highway Safety Office. We were awarded that grant. It's a 3-year grant. We're in the first year right now, and we have hired Trish with the bulk of that funding, at least for year 1. And we put together some broad goals for her to accomplish over the course of the year. And that really looks a lot at building relationships, looking into financing or funding options, and looking at some sustainable ways to really make a difference and move the needle in our area. And with that, I think I will turn it over to Trish and Christy for just a highlight of some of the things they've been doing recently.
Hi, everyone. Thank you again for having us. We're super excited to be here, as you know. We've been doing some great work in the community. Christy's been ongoing for probably a year and a half or so, doing her Choose Safe programming. What drives Smart Colorado, like we have talked about, is my role is to collaborate and make sure all of our efforts are being streamlined so that we're not kind of double doing some of the work that we've done up to this point. So what we've done is we've created collaborations with Choose Safe, which is Centura Common Spirit Health, the Party Program, which is UC Health, and Teens in the Driver's Seat, which is the Texas Transportation Institute, for our middle school and high school safety programming that we're bringing into the high schools and middle schools. I'm going to touch a little bit on each of those, two of those, and Chrissy's going to talk a little bit about Choose Safe. If you see the pictures on this slide, this is an event we just did at Calhan High School, which they actually had a K through 12 program. It was an amazing success. The teens, it was a peer-to-peer, obviously, education program, because we know that that's what's most successful with the students. The FCCLA club took it on and did the K through 5 in the morning, did all the pedestrian and bike safety with the kiddos. And then the high school was in the afternoon, and we did all kinds of kind of some fun games, but they all have a purpose and have some education in behind them. They also had a big rig out there to talk about big rig safety. Teens in the Driver's Seat was the one who brought all that in. They're, like I said, a nationally recognized program through the Texas Transportation Institute. Last year in Colorado, they had over 50 schools, but they only had 5 here in El Paso County. So the lack of that they have in their program is a boots on the ground person. They have an amazing research-based program, but they don't have a boots on the ground person. So because I have a background of being able to promote Teens in the Driver's Seat, I volunteered that, hey, we love your program. We know it's good. I'll be happy to support it in our community. So we're really trying to make sure that it's cohesive with what's currently going on here with Choose Safe and the Party Program and any other community partners, in combining them all in the high schools. Because all of the teen programs, they just have a tiny bit of a difference in how they approach it. Teens in the Driver's Seat ideally is a year-long program where they complete modules throughout the year, so the education is continuous. And they also have an opportunity to earn $1,300 as well. So in Colorado, we actually this year have 20 schools in El Paso County that we can sign up for this particular program. And hopefully next year it will be more, because they're trying to work with CDOT as well. We also have the Party Program, which is offered through UC Health. The Party Program is a 5-hour in-hospital injury awareness and prevention program for high school students. The goal of the Party Program is to provide young people with information about traumatic injury, which enables them to recognize potential injury-producing situations, make safer choices, and adopt behaviors that reduce risk. This program can also be taken on the road. I have yet to work with the program, but I'm super excited to support Lori Morgan in her efforts. And our next program is Choose Safe with Christy Tennant. She's going to tell you a little bit about that.
Thank y'all for the opportunity. Go
For
ahead.
some reason, I'm struggling. It's choose, CHOOSE.
Choose.
Okay, all right. But for some reason, I'm having difficulty
That's okay. It
hearing
is-
that word. I've been
It
struggling.
is an unusual
Okay.
name. So the name actually came from one of our community partners, Terry Vogel, whose husband was killed while bike riding. So she developed that name. So I was going to say thank you for letting me speak. My name is Christy Tennant. I've been a nurse for 21 years. The majority of my nursing career has been in pediatric flights. So when it was time for me to leave back in 2021 and move on, I wanted to find something that was meaningful, that I could save the kids that I used to try to have to save after injury on the front end. So I was hired as an injury prevention specialist. I'm now the injury prevention program manager for Common Spirit Mountain Region. And I came into it as a level 1 ACS trauma center. We have to address our top 2 mechanisms of injury. Number 1 is older adult falls. Number 2 is crashes. So older adult falls is fun, but really crashes is where my passion is. So when I started back in 2021, we were kind of the victims of COVID, like everything else. There wasn't any programming in schools, and we needed to fix that. So since the Drive Smart was still around as a coalition, but there wasn't any programming in the schools anywhere. A bunch of the people that do the same job I do for Common Spirit came together and built the Choose Safe program, which is essentially a Drive Smart 2.0 program. And we started rolling it out to the schools. So we've been at it about 10 months. Last year, we had one high school, and it's kind of been an uphill challenge. We decided, I felt very strongly that the kids needed something they could engage with and actually do versus just being lectured to, because they end up just on their phones, not paying attention. And we wanted something engaging. So we purchased pedal carts with the help of AAA. So we go to the schools, we offer pedal carts, distracted driving goggles, DUI goggles, presentations. We have amazing community partners. If you don't know how amazing the motors and the SRO units here in the city are, I'm telling you, they are phenomenal. And they've backed us without question, any school we want to go to. So as of this year, we've reached 6,640 kids, and that's a lot. And we have 5 more schools to go by the end of the year. So we've been super, super busy and couldn't do it without partners like Trish, Police Department, Fire Department, Callahan Fire and Police were instrumental in that school all throughout the Springs. Fountain, we're setting stuff up down in Fountain now for the upcoming week. So that's kind of what we've been up to. As Common Spirit, as an organization, we're highly dedicated to increasing safety in our communities. We want to address that mechanism of injury that is taking so many lives. Just in Colorado Springs, last year we lost 50. We lost 7 just in January this year. So it is something we're dedicated to, and me personally, it is a passion of mine, and it's a mission I'll be on until I for real retire. So if you have any questions, let me know.
Thank you, guys. So Danelle's got the next part, but I wanted to just pause for a second. First off, we had talked about Drive Smart, and I was remiss by not mentioning John Henry. He started Drive Smart like 30 years ago. He really wanted to be here today, but unfortunately he slipped on ice and broke a rib, and then he got the that cough RSV thing everybody got, and he broke a couple more ribs just coughing. I don't know how painful that is, but it certainly sounds pretty darn painful. So anyway, if you think, keep John Henry in your thoughts, but as he's recovering, he is a driving force in all of this. Other thing I wanted to mention before we get back onto the agenda and get back on track is the $1,300 that Trish mentioned. That's not per individual student. We don't have that much money, but that goes back to the school to do club activities and other things. So it gives them an incentive as the kids are like, hey, yeah, we want to have this trip, or we have this dance, or we have this whatever. How do we fund it? By doing all of the things within there. It's a way for the clubs and other things to earn money. So on any of those, if you have a high school that you want to connect and be part of any one of those 3 programs, and you can do all 3, I would encourage you guys to get in contact with Trish and Christy to do that. So back on our agenda, we're actually quite towards the end. So soon we'll hand it back over to you for you to ask us any questions and utilize our panel of experts. So we've got the Regional Crash Safety Action Plan, and then I think we go with the causation study, and then we'll get to you guys. Thanks.
So one other grant opportunity that came up in the past year is the Safe Streets and Roads for All program. So this is a federal program that provides money for developing a safety action plan. And then there's also a program that provides implementation funding for construction of the projects that were identified in the action plan. And so we as PPACG kind of partnered with the city of Woodlands, I almost said Woodland Springs, Woodland Park. Kimberly Burleson has been wonderful in helping pull this together. And so the city of Woodland Park is the official sponsor of this project. And we were successfully awarded a grant to conduct a certified safety action plan for the entire region, with the exception of Colorado Springs. And that's because Colorado Springs was already pursuing that grant separately. And because of the kind of urban nature of the city, we kind of decided to break it up into 2, although they were also awarded. So that that safety action plan, we just did a kickoff with FHWA last week. And so we are getting that grant agreement in place, hope to kick off the actual project in the summertime. And with that, I will turn it over to Ted and Jason to talk about our crash causation study.
I'm going to give a little introduction, then turn it over to Ted just to give you the background and context. So early last year, PPACG was looking through a lot of data to prepare for a January 2023 safety briefing for this board. And when we're doing that, we noticed that there appeared to be changes to some longstanding trends in crash data. When I mean longstanding, I mean decades long, as it turned out. Some really significant things. So from looking at state data, it appeared that for the first time, aggressive driving had surpassed impaired driving as the leading cause of serious crashes. So that's serious injuries or fatalities. And you have to keep in mind at the time, impairments were also getting worse. So aggression got worse so fast that it actually overtook something else that was getting worse at the time. And so looking back, as far back as we looked, aggression had never surpassed impairment before as lead cause of crashes for careless or reckless driving. So this happened in 2020, and then it appeared to stick that way. So this made us wonder, well, that came along with a worsening of serious injury and fatality rates generally. It made us wonder what happened, and it also made us wonder what else happened. So if we look further in the data, we talk to other people, what else are we going to find if this longstanding trend's been reversed? So we talked to a lot of knowledgeable people, did some looking around, wondered if there was an answer. Turned out there wasn't. Everybody knew something had happened, but nobody could explain it with any confidence, or if they did have a theory, they couldn't support it. So the data, the studies just weren't there. So we did some more searching and asking around. Long story short, it turned out we were going to have to try to come up with an answer ourselves. We didn't want to do the study. We were hoping to find the study. We couldn't find it. We wanted our messaging to be on target. We didn't want to do the same things that we'd done before the pandemic, before 2020. If the causes had changed, they would be off target and we'd waste our resources. So we hired the Olson firm to lead our study. I could give a lot more background, but in the interest of time, I'll turn it over to Ted Richard, who is our Olson firm project lead.
Good morning, Ted Richard with Olson. Happy Valentine's Day. So the goals and objectives of the study as we were given was to understand the post-pandemic, actually we'll call it the post-lockdown, higher crash severity statistics and conduct a traffic study compared to what was going on before the pandemic. So some of the questions we were charged with seeking answers to was reasons for the persistence of risk-taking behavior, other changes that increase serious crashes, a comparison to prior increases, because we've had spikes in crash rates and stuff before, but also looking at maybe what's different in the Pikes Peak region versus other parts of the country, and to figure out if pre-pandemic countermeasures are still effective or what countermeasures might be more effective now. So we started with a literature review. It turns out this is absolutely a national trend, and I can confirm that through observation that everybody we reached out to would absolutely wanted to talk to us, and if we could find the answers, they would certainly like to hear what those were. So in the national literature review, it was evident that crashes had declined, but serious and fatal crashes have increased. There is a higher percentage of serious and fatal crashes in the Pikes Peak region than the rest of the state. And the top reported crash factors in 2021 were aggressive driving, driver inexperience, or look but did not see. And these are collected from police reports. And that trend has continued as was alluded to. Second phase of the project is we went out and talked to people. We talked to people locally. We talked to law enforcement. We talked with local agencies about what they were seeing. We also talked with the people like the Insurance Institute. We actually talked with different mental health experts about what might be causing some of these risky behaviors. Some of the things we learned was that people believe that demographics have a role in this. During the pandemic, during the pandemic lockdown, it was evident that some of the drivers that were no longer driving on the road were some of our safest drivers. Thank you to all the ladies who helped keep the rest of us safe, but through safer driving. Basically, that pandemic enabled the most risk-taking drivers to drive on less crowded roads, and it also happened to coincide with less enforcement as we tried to protect our officers from face-to-face contact. And so these behaviors built up over time. That also aligned with what we were seeing nationally from some of our literature review. Countermeasures that were suggested by those stakeholder interviews, certainly outreach and education coupled with enforcement. John had that diagram up of the 4 E's of safety. All of those have to work together to create a more safe driving environment. We've just kind of finished up the data collection in phase 3, which is we did a bunch of public surveys. There was a short survey, Jason, that went out through. Tell me how the short survey was released.
There was a short survey that was out on social media in December and January, and then a long form survey that was up in January.
And so this was the short survey release. We asked a lot of provocative questions, and we actually got tremendous response on this short survey. Over 2,500 respondents. There was a split on what motivates drivers to speed, lack of consequence, time pressures, or lack of awareness. Respondents identified competitiveness with other drivers as the primary reason for aggressive driving. Other issues tied to stress, there was certainly a lot of input we heard from some of our mental health experts and other people that we interviewed, that just the stress of the current, definitely during the pandemic, the stress, political pressures, all of that kind of stuff was just contributing to an overall level of stress that was making people drive more aggressively. But that was not recognized by the public. There was strong support for enforcement and infrastructure changes, but less support for education and outreach, which I thought was interesting. The long survey, over 600 responses, and this was a pretty detailed survey of about 15 questions where we tried to dive deeper into the questions. First of all, 55% of those respondents were not even aware that there's been an increase in fatalities. Basically, this recent safety changes or trends. 58% think enforcement is the most effective intervention. 58% also think there is less enforcement after the pandemic, and 57% think their commute has stayed the same, which tends to reinforce that people don't think that just because you're late is a reason for people to be driving fast. In what might be considered, if I was guessing, some recency bias, 70% of respondents currently feel less safe than before the pandemic. By recency bias, I just mean that people remember what happened to them yesterday a lot better than what the conditions may have been 6 years ago. But again, that's just my supposition. This is where the survey respondents came from by zip code. We did it. I don't have any more granular data than this. We didn't want to make people put their addresses down or anything, but pretty wide response from across the MPO area. And so where we're at is we're finishing. We have to take all those survey responses and do some data analysis on those to see what kind of information that tells us. And then we need to synthesize all this literature review that we've done, the discussions we've had with stakeholders, the surveys, and we'll work on the next phase of the project, which is finishing the documentation of this. And then also what we're looking to do is create a kind of a toolbox of recommendations for countermeasures to address this challenge for the region.
Thanks, Ted. Thanks, Jason. So that in a nutshell is all the different things that we at PPACG have been doing. Some of them very direct through our staff, through your allowing us to include it in the work program to make them direct efforts. Other things like the high school education programs that others are doing, but we're partnering. And so with that, we're happy to chat about anything we've already said or anything that you want to talk about. Because again, if you've noticed, I've got a ton of experts back here because I didn't know when it was all said and done, after we sort of patted ourselves in the back and said, this is the stuff we've been doing, what you really want to talk about. So again, we've got engineers, we've got, again, Christy with Common Spirit. Again, that's one thing where there is private sector folks that are doing things. So we want to make sure that we increase our partnerships with the private sector. We increase our partnerships with the other not-for-profits and just sort of step everything up, because safety is one of those things where we're falling, I don't want to say we're falling behind, but it seems like the game has changed and we just need to figure out how the new rules are being played, so we can be as effective as we can with our resources. We'll never be able to get everybody to go out there and be safe when they drive. We'll never be able to get everyone to be courteous, but we can certainly work as hard as we can to sort of get back to where everyone has a little bit more comfort on the road instead of like what's the word, man? Thank you. So hopefully we'll get there. So with that, what would you all like to chat about and get our experts on their toes, or anything we've already talked about? Do you want me to do it? Mayor LeKind?
So the first question I have, just to confirm, there are no driver's ed courses in the high schools any longer.
Christy is shaking her head. Come on, but Christy, come on. I'll buy your next lunch at Red Grape.
As far as driver's ed, I do not believe so. But out in Calhoun, their school district has hired a transportation manager, and she actually teaches driver's ed after school, but it is through the district. So we're trying to kind of do some research and figure out how they made that a priority, because I personally, think that bringing driver's ed, driver's training, safety, education into the schools as young as we can go is going to change the culture. Because coming from a public health perspective, you've got to change the culture and the behaviors that yes, we can go into high schools and we can do these programs and, try to prevent it, but we've got to work back to the younger kiddos, in my opinion.
So my point on this was, I think we're all old enough to remember driver's ed with the films from the 60s and 70s that showed the blood splatter scraped along the concrete, the asphalt. And the children today who are learning to drive in third-party schools because there's nothing available to them, don't understand what's going to happen to them when the driving conditions are good, much less when you're going along 105 after a good snow before the plows have gotten there and they go head on with an 18-wheeler, as happened, 4 years ago, Holly? 5 years ago? If we don't start forcing the school districts to bring these kind of programs back, the drivers will continue to think there's no consequences, especially if there's no enforcement.
I have to speak to this just a tiny bit. So the research does show that in today's culture, the children that we're dealing with, they've seen a lot of blood and guts. It's what they look on TikTok, Instagram. They can look up any video at some of the most graphic things you've ever seen. So it's actually showing that it plays the reverse on their brain. They almost think of it as a joke, like, oh, check that, we were at a school, and quite honestly, they're saying that the crash cars and the stories of the victims, I sat there and I listened to the boys make a joke out of it, think it's funny, and they just have it. They're numb. The kids are numb nowadays because of what they view on their phones 24/7. So the peer-to-peer piece is trying to help normalize a different culture so that if you have their peers teaching them and creating a different social norm is going to try to, it's a slow process, but we're trying to encourage it in a different way and at a younger age where the safety piece is cool now. We have to make it cool from the younger age. Otherwise, they're just going to think it's a big joke. You know, that we've had them where they get the goggles on and they're, oh, let's learn how to drunk drive. And like, we really have to, and by the teenage years, it's tough. That's why I want to get it. My goal is to get Drive Smart back into starting, you know, in the elementary and then the middle and the high school. Hopefully by then, obviously that's, like I said, a long road. Might take us 5-10 years to really start changing those social norms because teenagers now, like, it's crazy. Christy.
Yeah, I got something for both of the points, and I'm so glad you brought this up because I'm with you on the driver's ed. It's business now. So there are businesses that teach our kids to drive, and it is expensive comparatively depending on what family you are. And that's something that I brought up. The Highway Safety Office came and I did a survey of the CDOT and our NHTSA, our highway safety programming we have around impairment. And they asked me if you could have a magic wand and one thing, what would you ask for? And I'd say funding for driver's ed. Because what I find in the community, I spend a lot of my time all over the Springs, Southeast Springs, various different places, rural. And that's something that you hear from the kids. They're driving, but they don't have driver's license. Because when I ask those questions, there are different sets of hands and the kids will tell you. And there's lots of factors behind that. Definitely been doing research over the last year as to why that is the way it is and how do we fix it. It's huge. Up in Denver through their RETAC, they have scholarships for safe driving programs. And I think that's wonderful. So they can go to driver's ed and it's paid for, but that's really cost preventative for, you say, you know, if there are 500 kids in El Paso County that need that and it's, you know, several $100s a piece, that's a lot. But we would love to tackle that. And as far as messaging to the kids, man, it's hard because you're constantly walking that tightrope of, I know when I've been driving since the 90s and it was exactly that. It was crash scene photos from one of the dads was a paramedic. And that was actually my introduction to trauma medicine. I found it pretty interesting. But the kids nowadays, yes, they're dying in crashes, but number one is mental health. They're killing themselves too. So we have to be very sensitive to that. So it's a really hard line to walk when you're talking with our youth today. You want to be respectful of where they are, but be real and honest with them because they know when you're not. But then also making sure that you're sensitive to not leaving a school and having the parents call up the principal and now you can't get back into the school to do safe driving programming. So it's multifaceted and it's complex, and I wish there was a quick fix. I'd be the first one lined up for it, but it's hard. Yeah, sorry. I'm Southern. I talk a lot. Sure. Okay, good. Sorry.
Okay, I want to tell you guys, thank you for coming on to Callahan and doing what you did, but I still wanted more shock and awe. Okay, and also the kids and the people involved in that, and even the police department and the fire department want these kids to actually, the shock and awe would make them set up and pay attention. Okay, and right now they were kind of lax a little bit, but then people out there kind of reinforced the intensity of what was going on. But then you look at the state itself, man. How are we going to get the state, man? They're actually trying to, they kind of dumb down the kids, man, when the kids can tell you, man, on the traffic law itself, cannot tell you, man, how close you're supposed to be, or general stuff like that. But then we want them to be worried about crashing. But if you don't know what the rules are too, I think that's a big point we need to start pushing forward to make the state, man, start, because you can have kids go get online and start studying for that test. And then on that test is the exact same answer to that question. And so the kid just blazes through it. Then you have people, men are actually supposed to be given a class on it, and then teaching the kid, they don't really care. They just want the mighty buck. So this is something we need to really address.
Can I be really honest with you? Okay. Should I say it? So we were out in Calhan, and I'm saying this because I know it's where we need to improve. The driver's ed educator was part of our program. She did the GDL will and was talking to the kids. I don't even remember how the conversation came up, but we were talking about buckling up and belting, and she said, I don't buckle up in town. I don't buckle my kids up in town. We were kind of like, wait a minute, you're teaching driver's ed, but that is a social norm in the small community rural. Oh, I'm just in town. I don't need to buckle up. I'm just going across the street so that's where I'm talking about. We've got to change those social norms in those small rural towns. They're saying, oh, I'm just going across 24th. You kind of need to buckle up. So changing those social norms with small towns with, every area is a little different. It's like that. We were all kind of shocked that, wow, you're teaching our driver's ed. You're not buckling up when you're crossing, from one side of town to the other.
But the effect that you guys had, man, I actually been teaching the kids just now. It was a small, small deal. Okay, it's actually a big deal, but a small part of the picture over it all.
Right.
But man, you actually rippled out to the adults, and their moms and dads were actually schooled a little bit, and people were starting to, it's actually a rippling effect if we can actually really get it.
Yeah. And that's what we'd love to do. My idea would be, this is my job, that I can come into the schools and bring community partners regularly throughout the year. We do a back to school night where we're talking about car seat safety and a lot of those little kids that aren't in boosters. So we just keep coming back. And I think that your community is a perfect example. It's willing, people are hungry for it. And so we're going to keep going back as much as we can.
Well, see, the blood on the pavement films is actually meant what that was called.
Yep.
Okay. But the thing is, like what I brought up during when we had a break, these kids are playing video games that are really graphic. Okay.
And that gets back to sort of they've become a little numb to it. So the shock and all is difficult, but I don't want what Christy said to get lost, because we have such a spectrum of the way people approach things nowadays, right? Used to be if you were sort of off by yourself, you were quiet because you didn't want to. Now it's like, I'll post this on Facebook and I'll shoot a video and I'll do all this, right? And so what Christy is saying about, you have to be careful and sort of in the middle of the road, because all it takes is one parent to come back and say, Christy was there and she showed this video and it was very disturbing, and my little Johnny can't sleep anymore. Well, now all of a sudden Christy can't get back into that school. And conversely, right, we've got, well, again, that's where some of these educators and principals are at. So we just want to make sure that we're maintaining the access, because if we can't get in, we can't do anything. So,
well, man, I know it's a balancing act, but you don't sway it to the point where that takes control of the whole topic, because, man, that kid driving bad may kill a whole family.
Yeah.
Okay. So it affects a lot of stuff.
Yep.
Okay.
Don't disagree with that. Certainly don't disagree that we need money for driver's ed back in our schools.
I mean, we did first program with Calhan in a while. So as we go, we can kind of bump up and figure out where we can go with that. I just met a lady that was part of Dress Up Colorado that has an amazing Shayna and Marshall. And apparently her story's it's a graphic, it's an impact story, which I would love to bring her in now that we've kind of gotten in. Everybody knows, what we do. And
so we do have PPRTA starting, and we had a couple more questions. Oh, I'm sorry.
Or
that's what you were saying.
Shayna works for Fountain PD. I've heard her story. Have Kleenex. Does anybody have a really quick question? I'm sorry to cut people off, but okay.
But, it's just something I kind of want to see in the study. The newspaper article yesterday was the House or one said that you can no longer drive with your cell phone while talking. I'm kind of curious, how much of the aggressive driving, if you were able to track how much is related to this guy on the being on the cell phone in the car in front of you or behind you, and then have the insurance apps on cell phones ever made a difference? And those are just things I'd like to see if you have answers to. You don't have to answer them right now.
Or we just say we'll look into it. I don't know.
I don't have the answer today.
Yeah.
I need to go back through all the data that we collected. Honestly, it was a couple of months ago and I'm old, so things fall out of.
Yeah, see if I could,
people.
I
But
know.
But I think those are excellent questions and topics.
Yeah, thanks.
Dave?
Yeah, I think it'll be pretty quick. So it was suggested that that difference in between 2020 and 2021 had to do with COVID. We only had bad drivers on the street, and then people had masks on, so the police didn't want to interact with them. But all that's gone away now. We're back to normal. The masks are gone. The numbers are still really high. And I'd like to suggest maybe something else that had a big impact on it was the George Floyd stuff. And then we have a shortage in police officers now, so I can't get speed enforcement done in some parts of the city. So shortage of police officers, different legislatures are passing bills where police can't pull you over if your taillights are out, things like that, because it's seen as, well, that could become an incident and then somebody gets shot. So state legislatures are dialing that back. Even Colorado Springs, we don't chase. I mean, cars, if a motorcycle takes off, they just get to take off. Do you think it's that side that is having an impact? It's kind of a self-inflicted wound because we are choosing not to allow law enforcement to really seriously enforce the law.
Well, that came up in a number of the interviews we conducted. It was a little bit of a theme. The tough part has been, I guess, demonstrating it, proving it. But a lot of people mentioned those things, social unrest, problems with the social fabric, politics. It definitely came up. And your first point, we think is really significant. With the lockdowns ending and with the pandemic period ending, how come it didn't self-correct? But it didn't. And in fact, after 2020, some of those trends actually accelerated. So that was another reason that we really wanted to dig in more in the study. And I'm not sure we have those answers yet. And I'm not sure which of those things we may be able to not prove, but show the significance of them with some kind of numbers or expertise. Anecdotally, I think they'll definitely be a part of the study.
And there were certainly stated and changes to enforcement during this same time period. And I know just by anecdotally driving down I-25 coming to work in the morning now, that has started to change. We're starting to see more presence on the I-25 at least, which has dramatic impacts on speeding.
Okay, I can tell you, I don't know if I'll be able to find it, but I've seen a study. I heard someone discuss a study, and it was actually in neighborhoods that were we'll call them neighborhoods of color, where the police had really pulled back. They were having even very high rates of collisions and things like that, and it's because enforcement they decided we're not taking a risk of having an altercation and being on the front page of the newspaper.
The cross causation study, again, as they were still working on it, it is scheduled to come back to you at the board in April. So with that, we'll hang out here if anybody wants to have an individual question, but we ate up a lot of your time and I appreciate you staying until the end. Have fun at PPRTA, everybody.